Hello and welcome to this webinar on bloodborne pathogen disinfectants. My name is Danica Harrier. I'm an occupational health consultant with WisCon. I also coordinate a few additional projects for our group. You might be wondering if bloodborne pathogen disinfectants are required at your site. To answer this question, consider whether or not there is the potential for blood to drip or transfer onto work surfaces at your facility. This could happen via minor cuts or more serious injuries such as amputations. If there are known diabetics at your site, it's possible that those individuals are checking their blood glucose levels by finger pricking. If you have designated first aid responders, those individuals may be responding to emergencies involving blood. In most cases, industrial sites should have a bloodborne pathogens disinfectant. Appropriate disinfectants are used to prevent the transmission of disease at your facility. These diseases include HIV, hepatitis B, and hepatitis C, to name just a few. The bloodborne pathogen standard, while not applicable at all work sites, requires companies to disinfect work surfaces with an appropriate disinfectant. A letter of interpretation indicates that appropriate disinfectants are EPA-registered tuberculocidal disinfectants or solutions of 5.25 sodium hypochlorite, aka household bleach, diluted with water. Let's explore both of these options, beginning with household bleach and water. The letter of interpretation indicates that the dilution ratio should be between 1 to 10 and 1 to 100. Meaning that there should be 1 unit volume of bleach per 10 to 100 unit volumes of water. If you're unfamiliar with calculating ratios, the math is easy. The first step is to add the ratio numbers together. So if you want to dilute to 1 to 10, add 1 and 10, which is 11. Then consider the volume of the spray bottle you'll be using. In this case, we are using a 32-ounce spray bottle. Divide 32 by 11, and you get 2.9 ounces. This means that 2.9 ounces of bleach would be added to the bottle, and the rest of the bottle would be filled with water. The math would be performed in the exact same way if the desired ratio was 1 to 100. At this point, I recommend that you visualize the logistics of using bleach and water. Imagine your employee grabbing a spray bottle, pouring bleach into the narrow opening of that spray bottle, and then topping off the rest of the container with water. And this would happen each time disinfection is needed. This creates the potential for employees to splash their eyes or body with bleach. This is concerning because bleach is corrosive and can therefore cause injurious tissue damage. This prompts some employers to consider the second disinfecting option offered by OSHA, a commercial product on EPA List E. The EPA List E as an elephant can be found using a Google search or directly on the EPA's website. On the EPA website, you access the PDF by clicking on the link shown by the red arrow. The PDF will then open and list pages upon pages of EPA-registered products to choose from. Most companies look at what products are carried by their supplier and then look for those disinfectants on the list. If they are on the list, those would be appropriate bloodborne pathogen disinfectants. Regardless of which disinfecting method is selected, employees must receive training. Employees should be trained on when to use the disinfectant and who can use the disinfectant, and also on contact time. Consider that in order to be effective, disinfectants must remain on a surface for a specified period of time before being wiped off. Employees should also be knowledgeable on which PPE should be worn while disinfecting and how to dispose of waste. To summarize what we have learned, bloodborne pathogen disinfectants are necessary at most industrial sites. Appropriate disinfectants must be selected, and these include diluted household bleach or products on the EPA List E. Employees must also receive training on how to use whichever disinfectant is purchased and provided by the company.